Mpox, monkeypox, what it is and how to prevent it. Welcome to our video on Mpox, formerly known as monkeypox. In recent years, this disease has garnered attention due to its potential to spread and cause health complications. Mpox is caused by the monkeypox virus, which can be transmitted from animals to humans and from person to person. Understanding the symptoms, transmission, and prevention methods is crucial for protecting yourself and those around you. In this video, we'll explore what Mpox is, how it spreads, who is at risk, and the steps you can take to stay safe. Let's dive into the details. What is Mpox, formerly known as monkeypox? Mpox is a disease caused by the monkeypox virus. The virus can be passed to humans from animals like rodents or monkeys, and it can also spread from person to person. In people, Mpox often leads to flu-like symptoms and a painful, itchy rash. Most of the time, treatment focuses on easing the symptoms. There is a vaccine for Mpox, and people at higher risk or those who have recently been exposed to the virus might be able to get it. While most people recover without problems, some can become seriously ill. In rare cases, Mpox can be deadly. What are the symptoms of Mpox? Mpox symptoms typically start within 21 days after being exposed to the virus. You may first experience flu-like symptoms such as a sore throat, a runny or stuffy nose, and a cough. Other common symptoms include swollen lymph nodes, fever and chills, headache, backache, fatigue, feeling very tired, muscle aches. About 1 to 4 days after these flu-like symptoms, most people develop a skin rash. The rash often starts on the face, hands, or feet and then spreads to other parts of the body. It can also begin in the genital area, mouth, or throat. The number of rash spots can vary, from many spots to just one. The rash goes through several stages. Flat spots become blisters, which then fill with pus, scab over, and fall off within 2 to 4 weeks. From the time your symptoms begin until the rash and scabs heal, you can spread Mpox to others, including pets or animals. If you notice a new rash or any Mpox symptoms, even if you're unsure how you got it, see a healthcare provider right away. How do you catch Mpox? Mpox can spread from animals to humans or from person to person. There are two types of the virus, clade 1 and clade 2, also called clade I and clade 2. Clade 1 is more common in Central Africa and usually causes more severe illness, with a higher chance of death. It may spread more easily than clade 2. Clade 2 is more common in West Africa and tends to cause milder illness with fewer deaths. Both types of the virus can spread to other parts of the world, often through travel or animal trade. How Mpox spreads between people: direct contact with the rash, scabs, or body fluids of someone who has Mpox. Close, face-to-face contact or sexual contact. Touching fabrics or objects that have been in contact with the rash or body fluids of an infected person. A pregnant person with Mpox can pass the virus to their unborn baby. How Mpox spreads from animals to humans. Animal bites or scratches from an infected animal. Contact with the animal's waste or body fluids. Handling animals for food, such as hunting, trapping, skinning, or eating infected animals in areas where Mpox is common. While rodents like gerbils, hamsters, and guinea pigs can carry viruses similar to Mpox, no cases of them getting Mpox have been reported. It's also unclear whether pets like cats or dogs can get sick from Mpox, but experts believe people with Mpox might pass the virus to pets through close contact. If you're worried about your pet's risk of Mpox, talk to a veterinarian for advice. Who is at high risk for severe Mpox illness? While most people recover from Mpox without severe illness, some groups are at higher risk for serious complications. These include people with severely weakened immune systems, children under the age of 1, individuals with eczema, pregnant individuals. Infection with clade 1 of the virus is more likely to cause severe illness than clade 2. What are the complications of Mpox? Complications from Mpox can include serious infections. Other infections in the organs or throughout the body can occur, leading to permanent problems like vision loss or even death. Genital rash pain. People with a rash in the genital area may experience severe pain that requires hospital treatment. Mouth or throat rash. A rash in the mouth or throat can make it hard to eat or drink. If you can't take in enough fluids, you may need to receive fluids through an IV. Mood disturbances. Some individuals may experience mood changes or develop a brain infection called encephalitis. Is there a vaccine for Mpox? How can you prevent it? Yes, there is a vaccine to help prevent Mpox called Jynneos. Here are some ways to protect yourself from Mpox. 1. Get the vaccine. If recommended for you, get the Mpox vaccine. 2. Avoid close contact. Stay away from people who have a rash that looks like Mpox. 3. Avoid certain animals. Keep your distance from animals that may carry the monkeypox virus. 4. Limit contact as a caregiver. If you're taking care of someone with Mpox, minimize contact with their belongings and fabrics. 5. Wash your hands. Wash your hands with soap and water, especially after being in contact with someone or an animal with Mpox. If soap and water aren't available, use hand sanitizer with at least 60% alcohol. Vaccine information. The Jynneos vaccine is available for people aged 18 and older based on their risk of exposure to the virus. You are considered fully vaccinated after receiving 2 doses, given 4 weeks apart. If you have already had Mpox, you do not need the vaccine. Who should get the vaccine? Healthcare professionals may recommend the Mpox vaccine for people who have been exposed to the virus or had a sexual partner diagnosed with Mpox in the last 2 weeks. Individuals with sexual risk factors for Mpox, such as men who have sex with men and have multiple partners or a newly identified sexually transmitted infection. Workers in healthcare settings, labs, or environments with animals that could carry the virus. For most other groups, health agencies do not recommend the Mpox vaccine. If you have questions about how to protect yourself from Mpox, consult a healthcare professional. How is Mpox diagnosed? Mpox can be diagnosed by a healthcare professional. During your visit, they may ask you about when you might have been exposed to the virus. The doctor will examine your rash and may take samples of fluid from it to send to a lab for testing to confirm whether you have Mpox. What is the treatment for Mpox? The treatment for most people with Mpox focuses on relieving symptoms. This may involve taking care of the skin to prevent damage from the rash, using over-the-counter pain medications to manage discomfort. If you have Mpox, it's important to stay home and avoid contact with other people and pets until your rash and scabs have completely healed. For individuals at very high risk of serious illness or death, a healthcare professional may prescribe antiviral medication to treat Mpox. Mpox in the US and UK. Mpox, previously known as Monkeypox, has been reported in various regions, including the United States and the United Kingdom. Here's an overview of the current situation in both countries. Mpox in the US outbreaks. The US has seen cases of Mpox, particularly in urban areas and among individuals who have traveled to regions where the virus is more common. Vaccination. Health authorities have recommended the Mpox vaccine for high-risk groups, including those who may have been exposed to the virus. Vaccination campaigns have been implemented to help contain the spread. Public health response. The Centers for Disease Control and Prevention, CDC, and local health departments are actively monitoring cases, providing guidance, and promoting awareness about prevention and treatment options. Mpox in the UK cases. The UK has also reported cases of Mpox, primarily among specific communities and individuals who have had close contact with infected persons. Vaccination and prevention. The UK health authorities have launched vaccination programs for those at higher risk and are conducting outreach to inform the public about the disease and preventive measures. Monitoring and research. Public Health England and other organizations are closely monitoring the situation and conducting research to better understand the virus and its transmission. Both the US and UK are actively managing Mpox through vaccination, public awareness campaigns, and monitoring efforts. If you are in these regions or have concerns about Mpox, stay informed through your local health department and follow recommended guidelines for prevention and treatment. The bottom line. Thank you for watching our in-depth look at Mpox. As we've discussed, being informed about this disease is key to prevention and management. While most cases resolve without severe complications, it's essential to recognize the symptoms and know how to protect yourself and others. If you have any concerns about Mpox, don't hesitate to consult a healthcare professional. Together, we can stay informed and safeguard our communities. If you found this video helpful, please like and subscribe for more health tips and updates. Stay safe and healthy.